Hi, Kevin Henry, the Group Editorial Director for Advanstar, and I'm on a Google Hangout today with Mike Uretz. He is a nationally known EHR and health IT educator and consultant. He's been involved with federal electronic health record mandates and incentives since they were first introduced, and is presently assisting dental practices and groups with obtaining incentive monies. He's also providing guidance to dental software vendors wishing to become EHR certified. He is the founder of dentalsoftwareadvisor.com, a great site, might I add, and that's a trusted industry resource on dental software information. So there's been a lot of anxiety surrounding the electronic health records mandate. So is it true that dental practices must have electronic health records by 2015? And if it is, then what are the penalties going to be if a practice doesn't conform to that?
Well, actually, to make your viewers feel a little more comfortable, the answer is there is really no mandate by 2015 to have electronic health records for dental practices. In fact, I have an interesting story, but it was probably a year ago that I was sitting in the chair with my own dentist, and I was involved with all this technology, and so he asked me, he said, Mike, is it true that I have to get electronic health records or the federal government's going to give me penalties or close me down? So there is a lot of confusion, and I think in some cases fear around that, Kevin.
So if there's no mandate, where did all this come from?
Well, I was trying to trace it back, and as you know, I've been involved with electronic records for a number of years, and I think what probably happened was there are actually two programs under the electronic health records mandate and incentive area. One is administered by Medicare and the other is administered by Medicaid. Now, under the Medicare program, there's definitely and I guess you can call it a mandate, but Medicare wants practices to have electronic health records by 2015, or they'll basically start dinging Medicare money from the practices. And as you know, dental practices, for the most part, really don't take a lot of Medicare. So actually that program is really more applicable to the medical world. Now, the good news is, in the dental world, dentists are eligible for meaningful use money under the Medicaid program. Okay, so dentists can get up to over $63,000 per provider if they're eligible under the Medicaid program, but there's really no mandate to do so.
So I know that you're working with Minnesota and their dental association on their state EHR mandate. So can you discuss this, and do you think this is a trend that other states are going to be following?
Oh, sure. No, thanks for asking that. So let's separate the different kinds of mandates. So we have the federal programs, we're talking about the federal incentive programs, the federal mandates, and then we're talking about a state program. So Minnesota was actually the first state legislature to actually put in there that dental practices must have electronic health records. Look, on top of that, though, the really interesting thing, and I think what's great for patient care, is that besides just having electronic health records for dentists, they also have said that these records must be interoperable with other providers. So in other words, a dentist should be able to send records back and forth to a medical provider, or a hospital should be able to send their records to a dentist. So Minnesota's kind of taken the first step at this. And because the federal government really wants to increase patient care and reduce costs and everything everybody's heard about, I think that other states probably will be following this as time goes on.
And Mike, after our viewers have watched this information, how can they get in touch with you for more information or if they have more questions?
Well, I guess probably the best way, Kevin, is if they want to email me at MikeU, M-I-K-E-U, at dentalsoftwareadvisor.com. Probably the best way to get a hold of me. They can also call at 425-434-7102. And I'd be happy to answer any questions. I really want to make sure that folks really understand this program because it can be very confusing.
Mike, as always, I really appreciate your insight and your time. Thank you so much.
Oh, thanks, Kevin. I appreciate it.